Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center.
And I am Leon Berthium, the chair of the NMC Board of Directors.
Welcome to NMC's annual report to our community for fiscal year 2019. This year, for the first time, in keeping with the advances of how the community communicates and shares information, our annual report is totally digital. This allows the information and stories you will find within the report to be accessed at your convenience and shared and referenced throughout the coming year. This approach came in alignment with local suggestions and national communication trends and was supported by the input from a survey of members of the NMC volunteers and incorporators. It is quite a change and will take some getting used to. We are proud of how it came out and look forward to this being a valuable source of information throughout the year. Fiscal year 2019 was a particularly dynamic, remarkable, and at times challenging year for NMC. We were once again named as one of our nation's top 100 rural and community hospitals by the National Rural Health Association's Rural Health Policy Institute. We also carry an impressive 4-star rating from the National Centers for Medicare and Medicaid, which is the highest rating among Vermont hospitals. Those are tremendous achievements. This annual report shares patient stories relating to emergency medicine, addiction recovery, childbirth, and surgical optimization through personal wellness, which speaks to the exceptional care provided here in our community. You will find celebrations of talented new providers who have joined our team and new ventures which have expanded our scope of services to meet community need. You will find that Rise Vermont community campaign to embrace healthy lifestyles, which began here in our community, has now gone statewide through the engagement of One Care Vermont in nearly all of Vermont's hospitals. You will find reviews of key events and important happenings that are part of NMC's pursuit of our mission to be a destination of choice for patients, staff, and medical staff. You will also find the financial details of our 2019 fiscal year. We face challenges under Vermont's revenue cap as we navigate the state's transformation from fee-for-service reimbursement to a capitation-based population health system. Shifting non-emergent visits from the emergency department to the more appropriate settings of urgent care and primary care is the right thing to do, yet costs us revenue. Similarly, we lose revenue when we're able to do surgeries on an outpatient basis that used to be inpatient, or when wellness services help a patient avoid or minimize medical interventions. You will also find that NMC has a history of some of the lowest rate increases in the state as we have worked to be prudent financial stewards. At the same time, this year saw higher than budgeted expenses from locum tenens physicians to maintain access to services in our community, as well as higher than budgeted investment in achieving an integrated electronic health record. These are all the right things to do, yet with the transition of healthcare reimbursement, they result in financial challenges. Fortunately, NMC's board has long anticipated the need to be prepared for turbulent financial times. We have the resources and savings for NMC to weather these challenges and emerge in the new system as a relevant and thriving center of wellness, focusing on the total health in our communities for years to come. We are so very proud of the exceptional care and service provided by our medical staff, and our volunteers.
We are grateful for our patients and families that have entrusted their care to us, and for our community partners who have played an integral role in so much of what we do. We want this to be, again, provide you with the best experience grounded in compassionate and personalized skilled care.
Our collective futures are so tightly linked as we pursue a healthier future for all. We hope you enjoy the annual report and we welcome your feedback on the new format. This is our community hospital that we are so invested in. Thank you for your continued support.